Good evening, everyone. My name is Mike McGinnis. I'm one of the student engagement coordinators here at Lansing Community College. Thanks for joining us again here on our weekly Wednesday student engagement live session here on Facebook. Tonight we have a special guest from our Health and Human Services Division. Loretta Osborn will be joining us. She is a recruitment and outreach specialist, and we will be talking about health-related programs and offerings for students at LCC out of the Health and Human Services Division. That beautiful building that you see on my virtual background behind us on our lovely campus in downtown Lansing. We are in our fourth session so far. Again, week one was kind of a welcome to LCC and an introductory get started admissions Q&A. Week two was a wonderful conversation with one of our financial aid advisors about costs and paying for college and how those things work. Last week, we had a terrific discussion about our Learning Commons and tutoring services and things that are available to students in this virtual environment, and how our students are still able to receive tutoring and group tutoring and things of that nature in this remote world. And again, tonight we have Loretta from our Health and Human Services Division, and we're going to have a great conversation about health programs and opportunities for students in healthcare and related fields that relate to an LCC education. In the future, if there's any topics or areas of discussion that you would like to see us present, if there's a department at LCC that you would like to learn more about, if there is a program that you've heard about that you would like us to elaborate on, please by all means let us know, and we are happy to invite those guests to join us here on these regular weekly sessions. We are participating with a lot of different campus partners right now in scheduling. We will have future sessions coming up with our LCC success team to talk about things like what is a success coach, who is a success coach, why should a student work with a coach. We are going to have a session coming up soon to hopefully promote some specific academic programs. We've had some interest from some program outreach liaisons who want to come on and talk to the audience about what their programs are and what kind of programs students can be involved in on campus. And next week, we're going to have a wonderful discussion with our new president. Dr. Steve Robinson is going to join us. And we are going to ask him all those hard-hitting questions about the role of the presidency at Lansing Community College and what that means for a student and what that means for the campus community and things of that nature. So please, if you have any questions for us, go ahead and type those in. Quick shout out to my wonderful colleagues, Cassie and Amanda, who are behind the scenes tonight, answering those questions and taking care of any of those requests that come in. But please let us know what we can do. We want to make these for our current students, our future students, our somewhat interested in LCC but not sure students. These are for all of you, and we want you to know that that's why we're here, and we're hoping to bring you information that you maybe couldn't easily find on the website, or just things that you could find an interest in learning more of. So also a quick shout out to the second place Detroit Tigers. I'm wearing my Tigers hat tonight, so go Tigers. I am going to invite Loretta to join me here. So give me just a second to do this, and we'll see if we can get her to come on screen with us and talk about health and human service programs and things like that at LCC. So, yep, here we go. So we have Loretta Osborn from the Health and Human Service Division at Lansing Community College joining us.
Hi, Mike.
Hi, how are you? Loretta,
Pretty
we can
good.
hear you, but we don't see you right now.
Oh,
There you
there we
go.
go.
How are you?
Doing well, Mike. Thank you
Good.
for inviting me to be here tonight to represent the Health and Human Services Division.
Yes,
Always pleased to talk about our division.
absolutely. You know, we, myself and the other engagement coordinators, we often partner with people like you on campus who are more specialized in those specific areas of campus. It's kind of our job to get the students applied and get them ready and get them in and able to start at LCC. And then we have a wonderful variety of people like you across campus who really are the more knowledge base in the program. We often get the questions about nursing or dental hygiene or things like that, for example. And that is truly where our partnership comes together of us being able to refer students your way for those more specific program information topics. So again, everyone, this is Loretta Osborn. She's the Recruitment and Outreach Coordinator for the Health and Human Services Division, which is housed in that beautiful building behind me that unfortunately none of us can go to right now while we are in this remote work environment. But Loretta, why don't you just start out and tell us a little bit about the division and maybe some of the program offerings and just some good general knowledge about what HHS is at LCC.
Great, I'd be glad to. Thank you, Mike.
Thank you.
Well, the Health and Human Services Division has both associate degree programs and certificates. And our certificates can range from 1 semester to 3 semesters. And our associate programs, of course, are 2-year programs. Now, people always think about Health and Human Services. They always think about the emergency professions like the paramedic and the nurse and the surge tech, which are all awesome. And we do have those programs. But what they tend to forget about are the diagnostic professionals like sonography, which is your ultrasound, rad tech, which is your x-ray program, and neurodiagnostics, which is similar to an EKG. EKG is for heart monitoring and neurodiagnostic is for brain monitoring. But also we have wellness components as well. For instance, human services, which is similar to a social worker, child development, kinesiology and fitness. Those are all part of the wellness components, and dental hygiene, as you mentioned earlier. So we offer both emergency and wellness career paths for students. And what's nice, if a person is sure they want to go into healthcare, they think they like it, but they've never been exposed to it, they could take a certificate, like for instance, phlebotomy. That's the person that draws your blood for when the doctor requires a blood panel. When you go to a clinic, that's the person who does it. Now that's 1 semester. And so in addition to having a skill that they've learned and being able to work in the workforce, they can continue on with their education. Many times students who are going into kinesiology will take a group fitness certificate program. So they can be working in the field while they're continuing on for their associates and perhaps a bachelor's, master's.
Awesome. So there's quite a variety of programs that students can look at. And would you say that sometimes students maybe think they want one thing and then when they find out what they really want is something else? Like, for example, a student may be interested in nursing and think they want to go into nursing, but come to find out something like a nursing assistant program is actually what they're after. What would you say to that student who maybe doesn't really know, but has the idea, like the general idea of what they want to do or what they might be interested? How would you differentiate to them what they could do?
Sure, I would. That's a very good question, Mike, because you're right. We have students coming from all walks of life at different ages, and exposure to the health or wellness components or professions. So I would talk to them briefly to see what their goals are. Do you want to be in the workforce quickly? Do you want to do this for a long-range career? What's your passion? Where do your interests lie? Is it research? Is it the emergency type person that you see yourself as? So talk to them that way and see where they're at, what education they have, and to continue on. Maybe it is a certificate to start out, like the EKG tech or the nurse aide. You're right, Mark. That's a very good idea. Many times students that go into our nursing program, which is an associate degree, will start out as a nurse aide. See if that's what they really like. Now, many times, the nurse aide, that's a person who's hired for the long-term care facilities,
Okay.
but they still have that patient interaction. So sometimes a person thinks they want to be a nurse, and then when they get close up and realize what they do, it's
Mm-hmm.
like, that's not me. And that's
Sure.
okay. Maybe you're a surge tech person that you'd want to be in the OR with next to the surgeon, handing them their instruments. Maybe
Great.
you'd like to be the person that takes care of sterilizing the equipment and the inventory for a hospital or a clinic. There are so many different roles in healthcare and wellness that it's nice to have that conversation with a student. When we get back on campus, I give tours all the time of our
Yeah.
area's state-of-the-art equipment, our clinics. But I can also have a conversation with them over the phone. They can talk to one of our program directors. And what's neat, Mike, I think about our program directors is they're licensed or credentialed in that field.
Oh, great.
They've worked there. So if a student says, oh, what's an average day going to be like? They know, they can tell them.
They've been
What's the
there.
demand in the workforce? Where will I be working? What do I do every day? They know that answer. So
Great.
they're a great resource.
Great. Great. Wonderful. That's a great, that brings up some great points because like I said earlier, it's very common for us on the engagement team to meet with a student, meet with a family, meet with a group of students at a high school, and we'll find a small cluster of maybe 4 to 6 of them who all want to be a nurse, or they all want to be a welder or something. So we
Right.
have tremendous partners like yourself. We have Nicole from West Campus who's going to be coming up on one of these sessions with us to talk about tech careers, where we can really get students the in-depth program information, more than just the surface level that they would get from someone like us on the engagement team. So it's a really wonderful partnership. And from all of us, thank you for all the work you do, to help us out on that.
Well, thank you, Mike. And really, kudos to you and your team as well, because when a student comes to LCC, they have so many general questions, and your valuable resources, getting them started, registered as far as admissions, and learning about the intricate systems that we have. So
Sure.
yeah, it's a great partnership, like you said.
Yes, we're all in this together, and we just want to see our students do well and be
That's
successful. So
right.
whatever we can do.
And to have them find their passion if they don't know. You mentioned there's a group that will always go into nursing, and that is true, Mike. There's a
Yep.
small percentage that no, I want to be a firefighter, I want to be a paramedic, and that's great. But most of us don't know what we want to do when we go to college. And
Yep.
this is a
Very
great
true.
place to start, a community college.
Very true. Very true. Thank you. So if you don't mind, we have a couple questions that we'd like to ask that kind of have come in and are a combination of some typical questions that we might receive, at a college fair, at a high school fair, things of that nature.
Great.
And the first one is, how do programs that are listed as selective admissions differ from other academic programs? And kind of just what is the difference, and why is there a difference between those programs?
That's a great question, Mike. Thank you. Because students will notice that in their advising guides for most of our associate degree programs, there'll be a selective admissions process. And what that is, Mike, is that it's a competitive process. We have a separate application versus like the application to apply to LCC generally.
Okay.
And then there's specific requirements, and they're all listed in the advising guide. And there's, for instance, there's prerequisites that they have to take before they go into the program. And students would say, well, why? Well, we want to make sure you have a basic knowledge so that you will be successful once you get into the program courses. For instance, you're in healthcare, biology, math, physiology, and anatomy. Those are courses that would be prerequisites, and they do vary slightly between programs. And another reason you say, well, why do you have to go through a process? Well, we have a limited number of seats for these programs. Say a person wants to take a history course or a writing course. Well, when the section fills up, the department or division has the opportunity to open up another section. When you're in the nursing program or the medical sonography, we don't have the opportunity to open up more sections because we have accrediting bodies. There are healthcare accrediting bodies that govern us. The college has the Higher Learning Commission, and we also have accrediting bodies, KHEP, JCERT, American Dental Association. These are bodies that review our curriculum to make sure we meet their state or national standards, and they set our seating max. So in other words, when you have 100 students that want to get into a program that only has 48 seats, you have to have a process.
Gotcha.
You select your candidates, and that's what selective admissions is.
Gotcha. Now, when you talked about the prerequisite coursework that a student may have to take for nursing or dental hygiene or whatever it is, does a student have to take those classes at LCC?
No, very good question, Mike. A student, especially a seasoned student, may have courses from a university or another community college. And this is where talking to an advisor is very helpful to make sure they would meet the LCC requirement.
Great.
And then if the advisor has questions about a particular course, they would contact our program director, and they would let them know they would want to see the syllabus, or they'd look at what the student had, and to make sure it meets our need as far as having that good foundation to be successful in our program.
Great. And when you say advisor, are you referring to one of our academic advisors that work with our HHS division?
I am either Eric or Angela.
Great.
Yes.
Okay. Yep. Shout
Now,
out to
all
Eric,
of your
Angela.
advisors are fabulous, Mike.
Oh, yeah.
All of them are. But as a student looks at our advising guides, they'll see it gets pretty complicated.
Sure.
Programs vary by their accrediting body standards. So it's always good to have someone who seems to work with that a lot. And Angela and Eric do.
Great.
So we appreciate their help.
Great. Another question is, earlier you mentioned that some certificate programs could be completed in as little as maybe one semester. What are some of those quick certificate programs? If we have a student out there who is maybe watching this right now,
Sure.
On their lunch break working at Meijer, and they're thinking to themselves, I want to go into healthcare, but I don't know where the heck to even start. I just want to do it fast.
Great.
What are some of those programs that someone could maybe look at and only have a semester, which for some people is roughly 4 months or so of coursework, and be able to go out and get a job in that field, and then kind of use that as a platform to maybe go further in that field? So what are some of those that we offer?
Mike, ones that can be completed in one semester where there's a great demand in the workforce right now: nurse aide, EKG technician, and patient care technician. Those are all one semester. Now, 2 semesters would be your phlebotomy technician, sterile processing, and pharmacy tech. And one of the reasons why those are 2 semesters is the first semester is coursework, and the second semester is an externship. You're already working in the field, well, you're not working there. I shouldn't say that. You're still a student, but you're working at a job site in the community, in the hospital or the clinic, versus being at LCC doing coursework on campus.
So you're getting that hands-on experience while you're still technically a student enrolled in your final coursework.
Exactly.
Wonderful.
Yes.
Wonderful. Do you happen to know what the job prospects are for some of those fields? Like what are kind of the, well, let me rephrase this by saying we're in a major healthcare, I don't like the term crisis, but we have a lot of healthcare happenings right now based on the COVID and the coronavirus and things of that nature. What are some of the biggest job prospects in terms of healthcare careers? Like, do we know that phlebotomy tech or sterile processing technician is going to be a high in demand job soon?
Yes, you're right. We do know the answer to some of those because we get calls from our industry partners
Wonderful.
on when our students are graduating.
Mm-hmm.
Pharmacy tech, there's a need. Phlebotomy, a dire need right now. And nurse aid. So again, like you said, those are ones that are quickly filled. Students can take the course and get certification and be in the workforce. There's also a big demand for paramedics,
Okay.
still a demand for nursing and dental hygiene. Not as heavy a demand, but always a need. We always fill that cohort as well.
Sure. Okay. So do we, and when I say we as in LCC, I'm a student, I'm interested in becoming a sterile processing technician. I come in, I do the coursework, I'm ready to go. Can the Health and Human Service Division, you mentioned those partnerships with locals. Can you guys help me get a job? Like, can you show me where I'm needed as an employee now? Can you kind of put me in that lane?
Well, as you probably realize, we have the Career Planning and Placement Office at LCC. And
Correct.
many times our workforce partners will call us and will refer to there. So because students
Okay.
look there for job postings. So that's a good resource. But yes, especially when I talked about those rapid entry that have the externships,
Mm-hmm.
you're right there in the workforce and they see your work right
You
there.
already have a foot in the door
You
through
kind of
your
do.
schooling. Great.
And also our clinical rotations that we have for surg tech, for sonography, for nursing, paramedics do an ambulance rotation. So those opportunities that are built into the curriculum are an opportunity for an employer to see you, see your work ethic, see your skill level and
Gotcha.
mastery. So in a way, yes, that helps students get jobs right away. It's an informal way to say, you might say, because it's not an official where we're sending them to someone on a job interview.
Sure.
But many times our program directors will say, your clinical rotation is like a month or two job interview. Yes, it is.
Sure. Okay.
So that's a valuable part that our industry has, and not all areas in academia have an externship.
Wonderful.
Or clinical rotations.
Wonderful. So speaking of clinicals, I just thought of a question here, and I'm a student. I'm from Boulder, Colorado, but I'm here at LCC and I'm taking my classes. My lease ends today and my clinicals start tomorrow, and I need to move back home. Can I do clinicals elsewhere? Do I have to do them in a certain location? How does that work?
Okay. Our clinicals are usually in our area.
Okay.
But we do have clinicals. It's not just the Lansing area. We have clinicals up through to Grand Rapids, to Detroit, because as you can imagine, in our different programs, we have to place all of these students. So it's not just Lansing proper. Now, Boulder, Colorado, I don't know because they're in state. Yeah.
Sorry.
But no, that's okay because we do have students from out of state. But based on where we get our clinical rotations, our agreements that we have, the program director seeks out facilities, hospitals, surgical centers, where our students can get that clinical experience that they need to meet the requirements by the accrediting body. So it is possible, Mike. In fact, that would be a good question when you would come to LCC and say, I want to go back to Grand Rapids, or I want to go back to Boulder, Colorado, and you want to be in the nursing program, or you want to be in surg tech. They would tell you if we have an articulation agreement already with a workforce partner there. So that's a detailed conversation you'd have with a specific program director. But we do have them around the state. And also, Like when the program director is placing their students at their clinicals, they do try to have it near their home. We have students that come from Jackson,
Sure.
uh, Grand Blanc, so we try to place them near their home base for their clinicals. It's not
Okay.
always possible, but we
Sure.
do try.
Awesome. Wonderful. Another question is, from my own experience, going to the doctor, for example, has changed quite a bit. Going to Ready Care is very different, in the last 10 years than it was 10 years prior.
Sure.
Now I'm not surprised to see a doctor come in, with an iPad and a phone and do a lot of his or her things electronically. How does LCC, how are we staying up to date with technology in healthcare, and things that we are providing to teach students with, based on, how the technology in general is changing
Sure.
minute by minute?
That's a great question, Mike. I appreciate that. First of all, as I mentioned before, our program directors are licensed or credentialed in their area. That means they still have their current license. They stay up with what industry demands are. They
Okay.
have continuing education. Also, we have advisory boards that for each of our programs. And the advisory board members are people in the community, the professionals that hire our students, the other professionals in that field. So they help us with standards, regulations that are changing, state-of-the-art equipment. So yes, you're right. We want to keep it cutting edge. And that's one of the things in our division I'm very proud of. We have state-of-the-art equipment in our dental program, our surge tech, our EMS, many of them. And the college has been very supportive of our programs to make sure we have state-of-the-art so that when our students do clinicals and when they eventually go into the workforce, they're comfortable with that equipment. They've worked on it, they've seen it. So that's how we keep up with the industry standards.
Excellent. Yeah. And I know our upcoming live session that we'll do with West Campus will have kind of the same thing where we have whatever the current model or state-of-the-art unit is, our students are learning on. That way there's no learning curve, and it also makes them a more attractive applicant because they can say, hey, I already know how to use this. Like
That's right. Oh, I've
I
seen
learned
that.
that in school, Great, great. So what is kind of the reputation of LCC, well, students or programs in local facilities? Like if someone goes to Sparrow and says, let's say their parents are both nurses or doctors, and they say, I kind of want to study this program at my local community college. What is the reputation of LCC's programs out in the greater Lansing area, at the Sparrow, at the McLaren, at places like that, to employers?
It's excellent. And I know it sounds like I'm just boasting, but we get calls from workforce partners all the time about our students. They'll take an LCC graduate anytime. We have extra skill hours. Our students are prepared. They pass their accreditation exams or their licensure exams the first time. Our pass rates are very high in comparison to the standard of that industry for that exam. So those are all good things to think about when you come to LCC. Our programs are credentialed, and our accrediting bodies come for site visits periodically based on their standards, 6 or 8 years. We pass our accrediting site visits. We have no problem with that. So our workforce partners see that. That's a reflection in how the quality of student that we have and graduate going into their facility or hospital.
Excellent. Great. Do you think there's probably students out there who maybe attended a large university, or are maybe even attending another community college, or did 10, 15 years ago? If that student is out there thinking, I'm too late to get into this, I'm past my prime of wanting to, jump in to be a surge tech or something like that. What would you say to that student who maybe is interested, has an idea of wanting to, dip their foot into the waters of healthcare, but thinks it's maybe not something they should do? What would you say to that student about what LCC could provide them in terms of that opportunity?
I would say to come talk with us, talk with me to
Mm-hmm.
start with, and we would have a brief conversation about their interests, their area, their experience, especially when you're talking about a non-traditional student like, or
Mm-hmm.
someone who has a bachelor's degree.
Mm-hmm.
We have students that go into nursing, for instance. They have a bachelor's in a non-related health field.
Absolutely.
We
Yep.
have a track for the student, the second degree student.
Okay.
So have them call me or email me.
Mm-hmm.
My number is listed on our website.
Mm-hmm.
So that's what we could do. And then I will connect them perhaps for an additional conversation with the program director, or we'll
Okay.
talk about the advising guide and see where they need to be in their next step.
Mm-hmm.
I'm confident that we can find a place for them at LCC.
Oh yeah, absolutely. Great. Um, I'm trying to just look over and see if we got any other questions here. So one thing I want to do real quick is just say, if anyone out in the healthcare world is watching this, thank you for what you're doing right now.
Yes.
We all have the absolute highest regard for our healthcare professionals right now. It's unheard of what we're going through, and they are battling this every single day. So we thank them, local, national, international. All of you are doing wonderful, wonderful work. And it's very encouraging to know that you go into it to do this kind of work, to provide these services to the people who need them the most. So that being said, in the current environment that we're in, we're all working remotely. Most of campus is closed. Your wonderful building that you're probably looking at on my screen is vacant, I'm sure. How has the current COVID coronavirus time period, I don't want to say changed healthcare, but what has it done to, have you seen more people encouraged by going into healthcare and helping people? What do you think are some areas that someone who says, I want to help fight this battle, where can LCC be a part of helping them fight that immediate battle in this healthcare pandemic we're going through?
Well, Mike, first of all, this pandemic is not the first pandemic or epidemic that we have seen.
Mm-hmm.
We've had many. Um, each century has a big one. Now, for the younger student that's here, they might remember the Ebola one. They might remember the H1N1 epidemic. So healthcare has seen a lot of these, and
Mm-hmm.
we work through them. We do what needs to be done,
Mm-hmm.
and then also maybe as you mentioned about state of the art equipment and procedures, things like that change as research goes on and we find out what we knew to increase wellness and help people stay well
Mm-hmm.
or get to that point. So this is not new for us, really, for a professional who's in healthcare. And
Mm-hmm.
Mike, I wanted to mention when you talked about someone who wants to get into it and is maybe concerned that they couldn't do it.
Mm-hmm.
You know, I don't know that I could do that. Isn't it scary? And I've had students ask that of a paramedic and also a nurse. So I'm going to paraphrase the answer that they give. No, they're not scared to do the job that they do.
Mm-hmm.
Now, with COVID, we know it's very contagious, and as many epidemics and pandemics are. And there is a risk,
Mm-hmm.
yes. But when they're trained, they say, when you know the training, when you have the protocols and you know what to do, how to protect yourself, how to protect your patient, you go into automatic remote control and you handle
Sure.
the situation.
Sure.
So they're prepared.
Okay.
So they're confident once they graduate, once they pass their licensure exam and go into the workforce, they're not afraid. They're energized to take on and help people. That's their passion. That's why they went into community service or healthcare, is to help the public. And that goes for like firefighters and public service when you talk about police and criminal justice as well.
Sure.
They all fall under that public service umbrella.
Okay. Wonderful. Great. We are approaching about our time limit here. So what I would like to do is just open it up to allow you to, if you had something to say that hasn't been said, maybe about the division, about the college in general, about maybe what a student needs to know kind of in the last minute or two here about our health and human service programs that maybe hasn't been said.
Okay, I briefly mentioned the wellness programs. We have child development. This would be your child care worker. And then also there's a certificate and then an associate, but it's also a nice track to elementary education, which is a bachelor's degree. We also have human services. You can get a certificate or an associate's. And then if you would choose to go on for a social work, that's a master's level. And you also have to have a license for that. But it's a place to start to see if you would want to be in an agency and helping people, individuals, groups, families, elderly, children. And then also kinesiology and fitness, the certificates and the associate degree. The associate degree in kinesiology, and many students don't realize we even have that, Mike, and that area is the movement of the human body, the study of the human body. So that is a precursor to your physical therapist, your occupational therapist, your athletic trainer. So these are areas that students hear about, and maybe they see somebody in that field, but they don't know where to start. Yes, you may need a master's. Yes, you may need a doctorate level for some of these career paths, but you can start here at LCC.
Yes.
You could take a certificate to see if this is your niche or if this is your passion. You can be in a certificate where you may have an externship and be in that workforce and see if you really like that field, see if you like working with those people, or maybe you see another career path that you have an interest in. With our certificates and our associate degrees, we're a quick pathway for someone to go into a career. Many careers, like for instance, the surgical technologist, the diagnostic sonographer, which is the ultrasound technologist, they tend to stay in that career, and also dental hygiene. So with an associate degree, you can make a marketable wage and be in it. Many times I see our professionals that teach for us, they were in that field their whole career. They didn't go on for a master's or a doctorate level in that career. They stayed there because they enjoy it. This is where their path is. That's their passion. So it can be here, and this is where you get your career and your profession, or you can go on. So there are a lot of opportunities for students in health and in wellness, and dealing with human beings.
Absolutely.
There's always going to be a need for these professionals.
Great. Yeah. And it's, obviously attending a community college, Lansing Community College in particular, we have one of the lowest tuition rates in the state of Michigan. So it's a very affordable pursuit for someone, even if they are planning on transferring to the larger 4-year, planning on getting a master's and so on. They're able to really keep those costs down over the first year, 2 years, depending on what their program is here. Just another follow-up to what you were saying is we often get students who will reach out to us and say, for example, I'm a entry-level nursing assistant or somewhere at a local healthcare facility, and now they're willing to pay if I go back to school again and I get this credential and I move up the ladder. So it's a great example of someone who could maybe start out small, get their certificate, get their associate degree, get their job, start working, start making money, start getting that experience, but also always have their eyes open to what is next on their horizon, and what a next promotion may be and things like that, and know that most likely we have a follow-up program for them as well, something they could look at, to further themselves past that first baseline education.
Mike, that's very true. And you made a very good point. I'd like to piggyback. When you mentioned a person that's in the workforce with a certificate, say a PC Tech, EKG, and they want to build on that, the college now has an associate in allied health. So an employee who has taken several certificate programs to better themselves in their workforce, then their employer says, oh, we want you to have an associate degree. They can take these stackable certificates, finish their gen ed courses, and have an associate degree. So
Okay.
that's a new thing now, Mike, that we're finding that workforce partners want, in addition to that credentialed nurse, the paramedic, or the dental hygienist. So that's a very good point. And see, so that's where the college is meeting the workforce needs and also helping the student while it be a professional in a field of their choice.
Awesome. Wonderful. Loretta, I really appreciate you joining us tonight. I know we are in a very different environment right now as far as everyone working from home, but still providing all of our great resources on campus. If we were live in person, I'm sure you would be zipping us around that HHS building and showing us all the wonderful labs and technology and equipment that's available to our students. But again, it was a really great conversation. I hope that anyone out there who has questions about some of our wonderful healthcare and related wellness programs and certificates and degrees, if you have questions, please follow up with us. Myself and my team, we work with Loretta and some of our other campus partners in HHS almost every single day. So we can definitely make sure we get you the information you need. And once again, to all of our healthcare professionals here in Lansing and Michigan, all over, thank you for doing the wonderful work that you're doing right now.
Yes.
Please know that people like myself and many others just have the utmost respect for what you're doing to help keep us going through what we're going through right now. So Loretta, if you have any final words for us, we'd love to hear them.
Okay.
Any questions, we're going to definitely follow up on. Yeah, this was wonderful. So thank you so much for
Mike.
joining
Thank
us.
you very much. But there is one thing I'd like to mention.
Yeah, of course,
when you say reach out to us, that's great. That's wonderful. But say, you're looking on our website at night and you just, it's like midnight and you were wondering about the health division and you click on any one of our degrees or our programs, you're going to see that there's a video there. So click on that video and that's going to give you insight to the program. You're going to see students that are in the program, in the skill labs, in the OR, in the dental hygiene clinic. So that's a great resource for you to kind of see what it looks like. You'll see the state-of-the-art equipment, you'll see faculty, and again, as I said, current students that are in that program performing skills or activities. And also one more plug for us, Mike. I forgot to mention that we have 2 community clinics. These are students for massage therapy and for dental hygiene. They have community hours that they have to fill for their degree program. Well, they have these clinical hours on campus, whereas the nurses and the paramedics rotate in our community partner facilities. These students have a clinic here on campus supervised by our credentialed faculty and licensed professionals, And so you as a student or a member in the community can come in and have a 1-hour massage for $25, or
Wow.
dental hygiene. You can have your teeth cleaned for $25 as a student, or $35 or $45 as an adult. Now, this semester, as we know, with COVID being a little different,
Sure.
the massage therapy program will not have massages this semester. Dental hygiene is going to be having our clinic open this fall semester.
Okay.
So a person could come in and have their teeth cleaned, x-rays taken, oral hygiene education in our state-of-the-art clinic.
So if someone is out there thinking, that's great, but I don't have dental insurance, so I probably can't do that, is that a requirement, or do they just pay the $35 or $25, whatever the cost might be, and that covers it?
That's a very good question, Mike. Since it is a clinic and we're providing the service so our students have experience, we don't deal with insurances. So
Okay.
it's a payment right straight from the client, rather than we don't bill insurances.
So,
But that's a very good point, because a lot of people do not have dental insurance. And so this is quite a savings.
Yes. So is this open to the LCC community or to anyone?
It's open to both, Mike. It's open to the
Okay.
LCC community and also students. The students will always get a reduced rate. It's $25 to have all those services, whereas it's a little more for the community in general, but not much. And so I have a telephone number if they would like to call our dental hygiene clinic for an appointment. Now, because we don't have any walk-ins with COVID right now, and sometimes people in the past would say, oh, you know what? I just walked in and talked to the receptionist and made my appointment. We're not doing that right now, as Mike said, because the building is closed and pretty much the whole campus. So please call us on the phone and talk to our clinical staff. His name is Patrick. He's very knowledgeable, and he'd be glad to give you information, but also book an appointment for you. And that number is 517 483 1458.
Okay, we'll make sure that gets posted right here with this video. So if people have questions, they'll definitely give Patrick a call and hopefully come on in and help themselves, but also help our students out.
We'd love to see you.
Great, great. Loretta, thank you again so much. This has been wonderful, talking about our great programs on campus. To our audience, thank you for tuning in. I'll just remind you quickly, next week we'll be back with College President Dr. Steve Robinson. So please, if there's questions that you would like to hear, those hard-pressing, hot topics that the college president can answer for you, please let us know. We're happy to address them. Again, healthcare workers, huge shout out to you for doing what you do every single day. Loretta, once again, it's been awesome. And I'm sure I'll be in contact with you probably tomorrow when I get a contact from a potential nursing or phlebotomy or other student. So thank you so much.
I look forward to it. Thank you very much, Mike, for having me on. Always a pleasure working with you and the staff at LCC and promoting our programs.
Absolutely. Absolutely. Thank you.
Thank you, everyone.
Have a wonderful night.
Have a good evening. Bye.
Thank you.